Hi everyone, welcome back to Melanoma 101 presented by AIM at Melanoma. I'm Melissa Wilson, and the goal of Melanoma 101 is to really go through the topics of melanoma from early detection and prevention all the way through diagnosis and treatment, and break them down into tiny bite-sized pieces to make them easier to understand. So if you enjoy these videos, please make sure that you like and subscribe to our channel so that you don't miss out on any videos in the future. Today we're going to talk about the routine skin exam. So what does this mean? So the routine skin exam is really a total body skin examination that is performed by a licensed healthcare provider. In the best case scenario, this is performed by a dermatologist. Dermatologists are trained in skin conditions and skin cancers. Some even have specialty in melanoma and pigmented lesion diagnosis. So really you want to have your annual exam with a dermatologist in best case scenario. Now, if you don't have access to a dermatologist, you live in a place that really dermatologist is 100 miles away for some reason, even a primary care physician can do a routine skin exam for you. But in the best case scenario, in a perfect world, you're going to be seen by a dermatologist. How often do these routine exams need to be done? Well, in the general population, we recommend an annual exam for a dermatologic visit. There are some special cases where you might want to be seen more frequently. Those include if you have a history of melanoma, if you have other skin cancers, if you are someone who has a lot of risk factors for melanoma, which would include things like atypical nevus syndrome or dysplastic nevus syndrome, or if you have multiple moles, like more than 20 moles, if you have other warning signs that are things like conditions that cause you to be a little more sensitive to the sun, like you had a bone marrow transplant, or you have had a transplant of another organ and you're on heavy doses of immunosuppressives. Those types of people might need routine skin exams a little bit more frequently, but for the general population, it's once a year. Now, what can you expect at a routine exam? I have to tell you that, and this is one of the most important things that I tell all of my patients, if your routine annual or however frequent skin exam does not go from the tip of your head to the bottom of your toes and involve looking through your scalp and on your genitals, underneath your armpits, between your fingers and toes, really you need to ask your provider to do a full skin exam, especially if they're only doing an exam from the waist up. You really need to make sure that you express your concern, that you are there for a total full body skin exam. Now, you can also give that information when you're making your appointment that you want to have a full exam, but really, if you're going there for your routine skin examination, your healthcare provider should really be looking at your skin from the top of your head to the bottom of your feet. Now, when we do the clinical exam in our clinic, we look through the hair piece by piece. We'll look behind the ears and in the ears, in the mouth, along the gums. We'll look at all of the skin that you can see. I'm having people, take their underwear and bras off. We're looking underneath, the toes, under the soles and hands of, the hands and the soles of the feet, between the toes, between your butt crack. Every place is something that needs to be examined. As we know, melanoma can develop in non-sun exposed areas as well. So the more things that you can look at on your routine exam, the better. Some healthcare providers will take photos during their exam. Others will prescribe something that's called mole mapping or total body photography that sometimes isn't done in their office. Sometimes it is. Sometimes it's done at another office and they will give you that information of how to schedule those things. But some dermatologists will actually take what are called ad hoc or photos of particular moles that they want to watch that don't involve, full total body photography. So that's something that you can sometimes expect. If your dermatologist doesn't take pictures, that doesn't mean that they're not a good dermatologist. Some don't have the capability of storing those photos within their protected server. So if they don't take photos, that's not a warning sign. You should not be worried, but some will take photos. If they don't take photos, a lot of times what they will do is have someone in the room with them, or will do this themselves, where they're actually drawing where the moles are on your body body on like perhaps a diagram or making a notation of them as they go along. And those descriptions will include like the size of the mole, where it's located, what it looks like, so that when they go back and do your exam next year, they have a little bit of a reference tool to go back to, to see if moles are evolving. So most important take-home tips from a routine exam: should be performed by, in best case scenario, a dermatologist, at least annually. Again, sometimes that's a little more frequent for people that have a history of prior cancers or other warning signs. It should be performed from head to toe and involve all the parts of your body that you may consider private. So definitely your scalp, definitely, in your genital areas, between your toes. A really good skin examination will include all of the places, even where the sun doesn't shine. So those are 3 really important tips. And the 4th one is really to make sure that you are with a provider that has a history of looking at at least pigmented lesions, that feels comfortable doing total body exams. Just like every other specialty, dermatologists do specialize in certain things. Some see a lot more psoriasis, some see pigmented lesions, some see, a little bit of everything. So when you're making your appointment for your routine skin examination, just be sure to ask the office or the provider, if they do do full body exams, and if they do see a lot of patients that have had skin cancers and melanoma. So got to do a little bit of your research on your own. No one will ever be offended by making sure that you're getting the care that you deserve. So these are just a couple of tips and things that you can look for in a routine exam at your physician's office. In addition to these routine exams, you should be doing self-examinations at home, and you can watch our video about self-examination as well to kind of get some tips about how to perform those. I hope that this video helps ease some of the anxiety of what you can expect when you go for your routine examination. If you have questions, please feel free to reach out to us on the Ask an Expert line. This is Melanoma 101, and I'm Melissa Wilson. Have a wonderful day.